Good morning, everyone. Welcome to this week's episode of Tooth Teacher Tuesday. Dr. Z here as your humble host as always. This week, finishing up the last few weeks worth of videos on the topics of different options for replacing teeth when we've got one or multiple teeth missing. Today, talking about the final of three main options for replacing missing teeth, which is dental implants, which are the newest and most exciting option for replacing missing teeth out there in dentistry today. So, for those who don't know, dental implants essentially are a way that we can replace missing teeth without, having to bond to neighboring teeth, like with bridges that we've talked about, or having to do something removable, like partial dentures. Implants are a permanent and kind of singular option for replacing missing teeth. And so, dental implant, as you can see in the middle here, is essentially just a small titanium screw, for lack of a better word, that is placed into the bone where we have a missing tooth. And so titanium, kind of like what is used in artificial knees and hips and other joint replacements, which makes it very successful for the body integrating that implant and not rejecting it as a foreign object. But titanium screw placed in the bone that, after allowing for some time to heal, for bone to grow into the threads of that screw, basically gives us a retentive permanent post on which we can then place a little abutment that can then have a crown cemented on top of it. And that's kind of the overall overview of implants. Now, it's a lot more that goes into it than I just made it sound. With dental implants, as far as the quality of the work compared to partials and bridges, dental implants are the best quality option for replacing missing teeth. However, implants aren't for everybody, and what I mean by that is there's a lot of factors that go into determining if a patient and if a particular site is going to be successful replacing implants. So some of those factors include, probably the main thing being that we need to have enough quality and quantity of bone. And what I mean by that is these implants come in various shapes and sizes, but there is kind of a limit to those shapes and sizes. And if the bone is too skinny or too narrow or not tall enough, or if the bone is very weak and kind of spongy, then typically implants aren't going to work there. We have to have, the right, you think of like building a house, you have to have a good foundation to build upon. And so because of that, not everybody's going to be a good candidate for implants. Especially with the upper back teeth, because of the way our sinuses hang below our upper back teeth. A lot of times the bone is too skinny there to allow implants to be placed. Now, in certain cases, there are procedures that can add bone in those areas to give us a better chance of doing an implant, but there again, that's not always the case either. Other factors would be things like the health of the patient in question. If somebody has some kind of bone-related disease, main thing I would think of is osteoporosis. Not only is the bone going to be weak, but a lot of times people that have osteoporosis will be taking medications that can affect the way the bone heals after surgery. So that could prevent someone from being a good candidate for implants. Other things would be if someone's a smoker, that's going to decrease healing. If someone has periodontal disease around their other natural teeth, then that bone and gum disease is not only going to affect natural teeth, it's going to affect implants as well. So a lot of things that have to be pre-screened with implants, but in the event that someone is a good candidate, then, as I said, the screw is placed in the bone, and typically we want to give a couple months for that bone to heal around the threads of that screw. Usually going to be, on average, about 2 to 3 months. And if after that healing period everything looks nice and healthy, the implant is solid and stable, then we're able to restore it with the crown on top. And different schools of thought. There are those out there that believe in doing immediate loading of implants, and what I mean by that is placing the screw and then putting the crown on top all at the same time. And it's a big controversial topic in dentistry right now. Two different schools of thought, whether it's good or bad. Not going to dive into that. That's not really the purpose of this video, but there are some practitioners that will do that. Doesn't mean it's necessarily a good or bad thing. There's success doing immediate loading, and there's also success kind of taking things slow and letting things play out. So otherwise, once we get the final implant, kind of the pros and cons of an implant are, the main benefit, like I said, from a dental standpoint, implants are the best option for replacing teeth because they act as their own individual tooth. Unlike the bridge where you've got teeth fused together, you can floss around these implants individually, and they also, because there's no natural tooth involved with an implant, you can't get a cavity. Now, like I said earlier, you can still get bone and gum disease around an implant, so good hygiene is certainly important, but at least you don't have to worry about cavities. As far as the cons go, again, the biggest thing is just the fact that not everybody is a good candidate for an implant. Tons and tons of research show us that even when we've properly planned out and pre-screened patients for implants, they still have about a 90% success rate, which means about 1 in 10 implants will have an issue for any number of reasons. The main one being that the body rejects the implant, and then we kind of have to go back to the drawing board from there. But other issues that can arise with implants, but still 90% success rate is a good number, and as technology and knowledge improves, that success rate's only going to go up. I would say the only other downside with implants is, it's not really a downside, but implants typically are going to be the most expensive option for replacing teeth, whereas removable option is going to be the least expensive and the most cost effective. Implants are pretty expensive, but it's kind of goes back to that old saying about you get what you pay for. If you pay more for dental treatment, the idea is that it's going to be of higher quality, and that's certainly the case with implants, because the idea with implants is that they are not only a permanent option, but a forever option, that they should, in theory, as long as everything's done right from the dental side of things, and as long as you, the patient, are doing everything right with your hygiene at home, in theory, implants will last the rest of your life. So that's kind of the overall big picture with dental implants. You could expand upon this further. There's plenty more topics related to implants, and in future episodes I'll get into those. But another big thing right now is implants. They can be used to replace one tooth, but also for people missing multiple teeth, implants can be used to make an implant bridge, which, kind of like the bridges we talked about previously, would just be two implants that have been connected with multiple teeth in between. Or could even go as far as doing a all-on X implant prosthesis, which basically means an entire arch of teeth, almost like a denture, that's placed on X number of implants. Usually it's going to be somewhere around 4 to 6. Again, a lot of factors going into that, but an all-on X that essentially is replacing all the teeth like a denture, but instead is supported by multiple implants, which is going to give it better retention and typically an overall better outcome. So again, I'll get into a little bit more detail about some of that in future episodes, but for the time being, I want to thank you for tuning in today, and I hope you have a great week and that you'll join us for next week's Tooth Teacher Tuesday.